2,334 new cases of people who have contracted the disease, 8 persons who have died, and those are 8 families that have been impacted. So as the positivity rate increases in the city, as the number of hospital admissions increase, it is just important that we work together collaboratively on the federal, state, and local level to get these vaccines out as quickly as possible. So again, 1A and 1B, medical professionals, people who are 65 and older, or people for Moderna, people who are 18 and older with a chronic health condition. And then we will move forward through the week. I will be getting the vaccine myself on Monday afternoon, along with several other people, and we'll do that publicly. And I believe that Congressman Al Green will be getting his vaccination today at this site, which happens to be in his congressional district. So that's going to happen today. Thank you, Congressman Green. Now, having said that, let me stop and let me first bring on Director Williams, and then Chief Pena, and then we'll go from there. Director Williams.
Thank you, Mayor. I want to echo the mayor's thank you to the police department. Chief Satterwhite and I were on the phone very early this morning talking about what they would have to do in order to ensure that this operation continue and not stop because of the difficulties we have. He assured me that they would come through, and as you can see, they came through. I want to acknowledge my Assistant Director, Decretia Limberick, who is actually in charge of immunizations, is one of her bureaus, and my Special Assistant, Rashay Jones, who we brought back in, who was one of my Deputy Directors, to ensure that we had a complete response to COVID as it relates to vaccines as well as testing. I want to also thank my staff for being very nimble and flexible as we had to make these adjustments given some of the difficulties that we made this morning. As always, my boss is usually correct. He told me, Stephen, people will show up. I had some doubts because of what we had heard about vaccine hesitancy. He told me that at 7:30 this morning, and when I came out, I saw that there were lines of cars that are out there. But the thing that impressed me the most is when I looked at the people in line, it is the people in line that we expected to see. It was our seniors. We know that 7 out of 10 people who die from COVID are 65 years and older. And if you look in line, we're actually seeing those folks, and I'm grateful for that. But what this tells me is that we have to be nimble in our approach to delivering this vaccine throughout the community. We know that we need to establish mega sites. We're looking at establishing additional sites within the Houston Health Department because we serve as a safety net provider. But one of the things that we do that you often don't see is how we actually support other providers in the distribution of vaccine. The mayor gave you one example of how we do that. We plan to also partner with pharmacies that are in communities with the highest positivity rates, and also FQHCs, which are in communities that we know are challenged socio-economically and are likely to have negative outcomes if they in fact get COVID. What you see today is something that, as the mayor said, we will replicate tomorrow. Tomorrow we will give you more specific information on how people can actually register. Starting Monday, we hope to have a variety of ways that they can register, including calling in. We have to maintain that call center because we know that everybody are not technology competent, and so they're challenged, and so therefore we need to give options for seniors and other folks to make appointments. And so we are looking at a system where people can self-enroll. That is in the making, and hopefully we can get that done so it will be operational for appointments tomorrow. We as the health department are committed to ensure the vaccine is available in our most vulnerable communities. It is what we do as a safety net provider, and we will do our job.
Thank you. And I will tell you, it's my hope that by the end of the year, and by the end of the week, and let me push my director and others, by the end of the week that we will have a mass distribution mega site set up. And of course, working closely with our federal partners, state partners, getting in the quantities that we need, then I think we can do that. We need to do that in order to exponentially increase the number of people who are getting this vaccine, because there is no question There is a demand, as you can see, and so we need to do everything we can to meet that demand. Let me call up Chief Pena. Before I come, I do want to thank this health department staff, because I don't thank them enough, because not only are they in charge of getting the vaccine in people's arms, they are also in charge of the testing. And we're having to do both at the same time. So getting the vaccine doesn't mean you don't get tested. It means you get tested still. Testing is still critically important. You still need to get tested, okay? And at the same time, we need the vaccines. And this health department staff is responsible for doing both at the same time. I want to remind people, these employees, city employees, have literally spent New Year's Eve, New Year's Day, today, tomorrow, through the weekend, working to meeting the needs of the people in this community. So I want to personally thank them for taking their time in order to do this. And so I really appreciate that, appreciate them as well. Chief Pena.
Thank you, Mayor. It's good to be with everybody here. I want to, before I move on to my numbers, I want to also echo what the Mayor just mentioned and give credit to Stephen Williams, to Cretia and Rashay for all the work that them and their staff have been doing. It's an incredible lift that they are undertaking. We have incredible demand out here in this community, and they have pivoted from their primary plan to Plan B to assure that we're delivering on what this city needs. So I want to give them credit, as well as the HPD and Chief Satterwhite for being as nimble as he is and getting the safety taken care of, and of course my boss, Mayor Turner, for pushing staff to ensure that we're getting the vaccines in people's arms. The Houston Fire Department, we have been making the vaccines available to our first responders, to our firefighters, since December 20th. We have St. Luke's, we have Methodist, we have vaccines available at headquarters, and we're immunizing all the 1As and 1Bs in our fire department. And as quickly as we're able to expand it to everybody, we're going to get all our firefighters and first responders and staff vaccinated as well. And we also stand ready to assist the health department in meeting the demand in this community for vaccination. So, Stephen, we have personnel and a plan to assist you all in meeting that demand. The Houston Fire Department today, we have over 225 firefighters that are in quarantine as a result of exposures to coronavirus. I know the police department is getting close to 300. And so it's incredibly important for us to get as much of the product, the vaccine, in so we can administer it to our first responders, our health department, and everybody that really needs it right now, because in order to continue what we're doing, we're going to need to be able to have the volume in hand to be able to administer that vaccine. So thank you, Mayor.
Thank you, Chief. Thank you, Chief Pena. Let me call on Congressman Al Green. We're in his district, and I certainly want to thank both of these congresspersons for their support in Congress. I appreciate them both fighting to get assistance to local governments. I know that didn't happen this time around, but it's my hope that at some point it will happen, because as you can see, we are calling on the police department to assist. The police department is not getting any dollars from this latest stimulus package. So we are pulling them from their other responsibilities in order to assist in making this operation work. So we're in the 9th Congressional District. Let me bring up Congressman Al Green.
Thank you very much, Mayor. I will be taking the vaccine today and flying to Washington, D.C. immediately after this press conference. And on tomorrow or some day thereafter, I will again be tested. I have been tested more than 13 times. I believe that testing and vaccination and washing of hands and social distancing and masking can make the difference. I want to thank the mayor for opening the first site in the congressional district, where we do have a lot of people who have been hesitant. As has been indicated, there are people who have been reluctant. And one of the reasons why I'm taking the vaccine today is because I want them to know that I am willing to do what I will encourage them to do. I think you have to lead by demonstrating that you're willing to do that which you would have others do who have a great deal of consternation. So I will do it for this reason. But I will also do it because I think that it is the patriotic thing to do. Our country is in the grips of this horrible pandemic. We have to extricate ourselves. Extrication requires that we all have some degree of compliance with things that can benefit us. So I'm doing it because I think it's a patriotic thing to do. I'm doing it because the people that I have to come into contact with by virtue of the job that I do should have some degree of belief that I am not going to in some way cause them to contract the virus. So I want to end with this. Mayor, you thanked all of the people who are in line. I too would like to thank the fire department. I'd like to thank the city health department, the police department. And yes, Mayor, I do want to acknowledge that we are still fighting. My colleague and I, Sheila Jackson Lee, is standing here next to me, and I think I can speak for her when I say we are both fighting to make sure we get the dollars to the municipalities. And not only are we trying to get it to municipalities, we want to have direct funding to municipalities so that we don't have things that are sometimes delayed in getting to municipalities. This is something that we're all in together. Every one of us has a role to play. I will play an additional part of my role immediately after this event so that I may demonstrate that I would have others do what I am doing, not what I say do, but what I am doing. Thank you, Mayor.
Thank you.
And Congressman, I look forward to giving the shot to you in a few minutes. Let me just say to you that as of a few minutes ago, in terms of registration for the day, the number is 746. So as of, what time is it now? Is that 2:30? As of 2:30, 746 have already registered to take the vaccine today. So I feel very confident that we'll provide about 1,000 vaccines today, which exceeded our expectation. And then, of course, we're already above, what did I say, 658 that have already enrolled for tomorrow, and that was 30 minutes ago when I got the numbers. Let me now call on the Congresswoman from the 18th Congressional District, who has been very active in setting up testing sites and along with Congressman Green, been fighting very, very hard and advocating on behalf of municipalities, not just in their respective congressional districts, but throughout the United States. Congresswoman Sheila Jackson Lee.
I've asked my colleague for one privilege. I am Houston's oldest teenager. I do fall into the 1B class. So that's important for people to know that I am in 1B, over 65. Thank you very much.
Thank you very much. Let me thank the mayor of the city of Houston and officially say that I believe that Houston may be the very first city of this size to set up a massive distribution of vaccines under the CDC coding between 1A and 1B. They may be the very first. And I believe that deserves an applause and a recognition that they understand the desperate conditions that we're in. Let me thank Decrecia and Roche. Let me thank Director Williams, Chief Pena, and really your team that has really suffered and faced COVID-19 head on by so many in quarantine. Chief Satterwhite as well. I see it every day. Your staff out in the fields and, of course, being impacted by COVID-19 as well. I think it's important to say two things or several things that I want to bring to the attention. I'm glad to be here with my colleague in his district and glad that he is moving forward. My taking of the vaccine came under the continuity of government and was taken publicly by way of a picture by the Pfizer just a few weeks ago. And I truly believe that we should give the vaccine and give the second dose as well. And in order to do that, we have to do what the mayor has asked us to do, and that is to bring the money here. So let me indicate what is expected to come to the nation: $342 billion for vaccine distribution. They will be in direct grants for states and localities, And I'll join with my colleague. We want to fight for direct funding to the county and city government. We want on this particular funding for vaccines and distribution, direct funding. $2.58 billion is to fund CDC vaccine distribution and infrastructure, and $129 million will go for tribes and tribal. What that means is I am a strong supporter of using mass sites, universities, sports arenas, parks, faith institutions, and other sites that can do the distribution in a mass way, and there is funding in the federal government to give the cities and counties the ability to expand their staff, to logistically find sites, to pay their first responders. That is not anything that you should turn your head from. They've got to be out here. And we also know that people who are in line may even need support, health support, because we are seeing our seniors. So the idea is for us to go back to Washington to push that money out. It's already law. The COVID-19 package has passed. It's already law. We'll push it out. And I think the other point that we should make is that the federal government should take over and nationalize the federal distribution so that it comes out and is actually a complement to what the cities are doing, so that we don't have any questions about distribution. Finally, I think it's important to take note of that we are going to have to do at least 100,000 Americans a day. We are not at the 20 million that we were suggesting, and so this administration has a few more days, but the incoming administration is committed to helping our cities and counties do mass distribution and do it right, and to be able to save lives. 20 million Americans are infected by COVID-19, 1 in 1,000 are dying by COVID-19, and now close to 350,000 have already died. So I applaud this effort of being the first, I'm going to say that, that has set up this kind of distribution of the vaccine, the Moderna vaccine, and done so, if you will, by this size of city, but have done so in the manner that you have done. Let me thank you. We look forward to working with you and moving more vaccines out into the public.
Thank you. Thank you. Thank you. Well, we certainly look forward to working with our congressional leaders and federal leaders. What today demonstrates is that there is a huge demand for this vaccine.
Yeah.
And so I look forward to working very closely with our federal partners, with our state partners, to working to setting up mass distribution sites. And it's my hope that before by the end of the week, we will have those sites set up and really move forward. We want to be as aggressive as we can be at getting these vaccines in people's arms. So that's the goal. We don't want these vaccines to be sitting on the shelves. We want them out, and we want them in the arms of people. I'll stop right now, and we'll take any questions that any of you may have. What's up?
Mr. Mayor, is the city planning on opening up any more sites? You touched on this already. These are questions for KPR Day. With the demand today and the number of vaccines available?
Absolutely. This was just the first initial site. The city got its initial dosage, the city and the fire department, on Monday, just Monday, less than a week ago. So this is the first Houston clinic site that's been set up that is responsive directly to the community itself. This is the first of many that will be set up. In addition, there are a number of other providers who haven't gotten vaccine. We're providing doses to them as well. And then the goal now is to, and we'll provide additional information tomorrow for additional sites that will be made available. We'll have online opportunities as well for people. But I really would like to see a mass mega site set up by week's end.
Should schools be reopening with the current community spread going on?
We want to do everything we can to keep our schools open. I do know that Director Williams has been in direct conversation with, for example, with the superintendent of HISD. Are you free to talk about that, Director Williams? Yeah, because I think that's important. Director Williams, why don't you come on? I was going to say,
Yeah, I think that's a very important question. I had a conversation with Dr. Lake earlier this week, and my desire is to actually look at this population within the school system to ensure that there are vaccines available for them, because we really want to do anything to support continuing education for our children.
And let me just say that so the plan is to work with our area superintendents, with their nurses, their staff, to make sure that teachers and other educational support staffs, that they are getting the vaccine as well, because we do want to keep our kids in school as best we can. And so that means making sure that the teachers, the cafeteria workers, the bus drivers, and others receive the vaccine, especially for those that fall within that 1A and 1B category. So we'll be working with all of our area superintendents.
The Medical Center 7-day average positivity rate is at 15.9, 14-day average for Harris County and Houston on its dashboard is 14.5. If the positivity rate continues as it is now or increases, what is the city's plan to try to prevent the state's guidance to pull back or reduce capacity?
Well, the positivity rate is increasing. It's been increasing for the last 6 weeks in the city of Houston. The number of hospital admissions, that number has been increasing. The last time I looked, I didn't see it this morning, but yesterday morning I think that number was a little over 1,800. And again, during the summer, as a benchmark during the summer, the number was more than 2,400. So we are moving in that direction. It's been going up, not coming down. So we recognize that. The city has canceled all permitted produced events. We canceled those. I canceled those in March, and we really haven't undone that. And so we have never recommended going to full capacity on anything or 75% capacity. We've never done that. And so pretty much what we have operated, laid out the things that we can do within the cities and the county's abilities. I was contemplating at one time even doing a curfew, but you saw where Austin put in a curfew, and that's been challenged by the governor and the attorney general, and then the Texas Supreme Court said no to that because it would violate the governor's order. So I would just say we are doing everything that we can locally. As you know, we have been putting forth strong messages, both the county judge and I, repeatedly, over and over and over and over again. So we've been doing that. I would pretty much say, let me defer that question to the governor and to the people at the state level. I'm sorry.
I just want to add one thing, please. It's our responsibility to look nationally, and 14% is not a good number. But when you look nationally, you can see what we've tried to do here with the mayor's leadership, that our numbers do not compare to some of the dastardly areas that we now are dealing with. Look to our friends in Los Angeles, where they are highly saturated. They have large numbers of people dying. Someone said 1 every 10 seconds. I think that was the number that was being said. So the fact that we've had this kind of, hard hand on these large events, I think have made a difference. We're coming into a surge that is going to be unbelievable. That's what all the scientists are saying. And I think what we need to do is the community needs to continue to support this city and this county in order to make sure that our surge doesn't go up. What they have been doing has been making a difference. That's why we're trying to get these vaccines and money down here as quickly as possible. You can see the difference in what is going on here in Houston, Texas.
How is social distancing being handled at the airports today, and your advice for travelers?
Well, number one, I'm not encouraging anyone to travel. I think that's number one. I know there are certain people that have to travel. The last time I was on a plane was in February of 2020, okay? So unless you just have to go to Congress to fight for more resources for counties and municipalities, I'm telling people stay on the ground. But, look, putting on these masks are critically important. I cannot understate that enough. It's still highly important to put on masks. And I certainly have mine on. I'm looking for my other one. Here it is. If you get past one, I try to make sure you don't get past the second one. So wearing the mask, the social distance, all of those things are important. I do want to follow up to what the Congresswoman just said. Even though our numbers continue to rise, the difference from the summer is that they've been rising gradually, which gives our medical team a better opportunity to try to provide medical care for the people who have contracted this disease and people in the hospitals. If you look, for example, at the number of deaths across the country, we are like in the major cities, we are down the chart. We are behind cities like New York and LA and Chicago. When you look at the numbers, when you look at the number of people who have contracted this virus per 100,000, we are still down the chart. So relatively speaking, yeah, we are not as bad as many places, but it is still concerning when the positivity rate continues to rise and when the number of hospitalizations continue to rise. That is concerning. But you don't want to lose one person. But for example, we're reporting 8 deaths over 2 days today. So we just have to continue to do what we have done in the past when we curve what took place during the summer. And that is to keep these masks on pretty much unless you're eating or drinking, keep these masks on and avoid large crowds. If we do that together and then take the vaccine, then we can arrest this virus, blunt its progression, and then we'll be in better shape. I still anticipate that 21 will be a heck of a lot better than 2020.
Director Stephen,
yes.
I want to get a clarification for the population. Chronic diseases are not pre-existing conditions. High blood pressure alone, diabetes alone, cancer alone, could that be an indication, a criteria for 1A, or what are they considered in order to qualify so that we don't get people jump over the line?
Steve?
Actually, if you look at the state website, I think you're referring to 1B. It says individuals that are 65 and above, and it says individuals that are 16 and above with one of the 9 conditions that are listed, but it also says such as. So it's not limited to just those 9 conditions. Type 2 diabetes, COPD happens to be 2 of those. Individuals with a BMI of over 30. Actually, I might look healthy, but my BMI is actually over 30.
Any other?
Yes, Mr. Mayor, the Congresswoman talked about the different buckets of the money that are supposed to support or bring about the vaccine to the population. Now, is the city department fighting, contesting, competing with the other health units that are federally booked to provide the vaccine? Is the city trying to go ahead of them? Is the city trying to tell CDC to first send the money to the city to decide what are the criteria? Are you trying to undermine what is already on the plate, or what was the congressman actually saying as you understood?
The short answer to that is no. We're not trying to undermine any process. We, as the Houston Health Department, are a directly funded city. There are several directly funded cities within the state. San Antonio, Tarrant County happen to be, and Dallas happen to be examples of those. We have about a half dozen funding streams where we get funds directly from the CDC. And so what we're encouraging them to do is to use those already established funding streams to give us resources to fight COVID-19.
And a follow-up question, mass vaccination actually requires that the mass monitoring and evaluation of the vaccinated be done still for 15 minutes. Are you sure that with all these massive centers you want to open, you have the personnel to be able to man them and take care of the supposed evaluation and assessment that is required for 15 minutes and other problems like allergy?
Actually, you see that exhibited here indoors. We've actually done a test run, a simulation where we brought over 300 people through a drive-through on this same parking lot. And we did observe the 15 minutes or the 30 minutes observation that needs to occur.
Let me just say the goal is to, in collaboration, in conjunction with our hospital systems, with EMS, with the fire department, with the providers, the additional providers throughout the city, the goal literally in the month of January is to do hundreds of thousands of vaccines just in this month. We have to get there. We have to get there. I know the New York mayor announced that they were going to try to do 1 million vaccines in the month of January. That's in the state of New York. Frankly, working collaboratively with our healthcare system, all of our different providers, setting up mega sites. I think we can do the same thing in the month of January. Quite frankly, I would like to do even more than that, working with everybody. But that's going to require a lot of coordination between the feds, the state, and the local units. But that's the goal. I mean, what we are seeing today is that people want the vaccine. And I will tell you, quite frankly, we are taking the vaccine in public to encourage people to take it. Well, you don't want to encourage people to take it, and then they say we want it, and then it takes several weeks, if not months, in order to get the vaccine to them. So we have to have the mega mass sites in order to meet the demand. And that's going to call for a greater quantity coming into the local units, working in collaboration with the county. Judge Hidalgo and I have been working very closely with one another. So if the county, the city, the other healthcare providers, the hospital network in the city of Houston, if we all work together in a seamless process, then in the month of January, I would like to think that we can do quite a bit in the month of January. That's the goal. Anything less, we're going to fall short. Anything else? Anything? Okay, thank you all so very much. Again, I want to thank the staff. I know it was a hiccup this morning, but quickly pivoted. And again, I do, Chief Satterwhite, I do want to thank HPD for really managing the traffic management system. I mean, just a fabulous job. And to the healthcare staff, I want to thank them profusely for what they have done. I know I was on the phone quite a bit with Stephen Williams, and so I want to thank him. I want to thank the healthcare staff, and want to thank these healthcare employees who have been working through the New Year's. Okay, New Year's Eve, New Year's Day. Today, I want to thank them because these are city employees who are taking their time to make sure that we meet the needs of the people in the city. And quite frankly, we don't thank them enough. So thank you all so very, very much. Okay? Thank you. For today, the number is 7.